So the idea of vaccine passports, which I think we're unlikely to see become a feature of federal law or federal regulation, but much more likely to see become effective when big private sector companies enforce them. You can't fly in airplanes, for example.
Yeah.
Maybe you can't stay in hotels.
Yeah.
Who knows?
Yeah.
That's coercive, obviously. And as for the vaccine as you are, once again, you've taken it yourself, does a vaccine passport kind of violate the principle of patient autonomy?
Look, I think mandating vaccination does. Let's take some time about this vaccine passport. I think it's going to be a disaster, an absolute disaster. Look, we can't even get our act together to get people to register to vote properly.
Good point.
Let me ask you a question. Who do you think's going to get excluded from this vaccine passport? It's not going to be the nice people in Naples, Florida, or Newtown, PA. No. It's going to be the good folks who live in North Philly and West Philly.
It's totally true.
It's going to be people in Washington, D.C. and in the Deep South and in Western PA who don't have access, don't have the health literacy that it requires, right? It's going to be a disaster for civil rights, for equity.
No,
it's
you're
going to
totally
be a disaster.
Right.
But the other point I wanted to make about this vaccine passport, I think we should not call it a vaccine passport. This should be if there is any such thing ever, it should be an immunity passport. So in other words, if you've had a natural infection and you can demonstrate that you have IgG levels in your blood that are protective, or if you've been vaccinated, you should get this thing, whatever this thing is going to be, right? I don't agree with this thing ever coming into existence, but if it's going to come into existence, it should not be a vaccine passport. It should be an immunity passport. So if my brother-in-law or my sister ended up getting COVID, and I can show you that they have 85 to 90 times the level of antibody off baseline, they're immune. Why are we forcing these people to get vaccinated on top of it?
Well, this raises a larger question, which is why the focus on the vaccine and vaccination? The focus, I imagined, of public health would be public health. But instead, getting the vaccine appears to be an end in itself. And I'm not alleging any kind of malintent or conspiracy, but it's very striking and it makes me nervous.